Good day, everyone. Welcome back to our YouTube channel. Thanks for liking, thanks for subscribing, thanks for commenting on our videos. But if you are yet to subscribe, please do so. And also click on the notification button so you'll be notified whenever we post a new video. So today I will bring to us a topic just like the way we used to talk about hypertension. So today I want to talk about the opposite of hypertension, which is hypotension, which is lower blood pressure. And majorly the major reason for making this video is to let us know what it entails and what are the causes, and as well the major thing is to know the preventions you need to do so as not to fall into or being a victim of this condition known as hypotension. Yes, I know hypotension is a condition whereby you have low blood pressure, and that can occur when there is low blood flow, blood circulating in your body. When the circulation of blood is not circulating as the way it should or the way it's expected to circulate in your body. So when there is low blood flow or low blood circulation in your body, you tend to have blood pressure, and that's our topic for today. Low blood pressure, which is known as hypotension. Hypotension is when you simply have less than 90 systolic and less than 60 diastolic millimeter per mercury. That is when you go to your clinic or your health centers and you are told that you have 90 or 89 or 87 or 85, 60, 85, 40, 85, 50, or anything less than 90, 60 millimeter per mercury is known as low blood pressure, because the blood in your body is not circulating well, or probably there is low blood circulation in your body. So you need to do something, because it can lead to shock. Why? Because the organs in your or the tissues in your body, they will be deprived of blood circulation, they will be deprived of blood. And for all these organs in the body to function well, they need blood flow, because blood helps in carrying oxygen, carrying nutrients all through the body. They help supplying the organs, the tissues, oxygens, nutrients, and all other things they needed for them to be able to function well. But when there is low circulation, then you have low blood pressure. These organs will not be able to work properly the way it should. So that's what low blood pressure entails. So today I will talk about the causes and the signs and symptoms of hypotension, which is known as low blood pressure. One of the causes is dehydration. We have always been talking about drink water, drink water, drink water. It is just as if it is a hymn. It is not something necessary. It is something we overlook every now and then. We see it as a poem that it is always, almost every day you hear it here and there. Drink water. It is because it is essential. Water does a lot of things in your body. It helps your body a lot. It helps your body prevent dehydration. And dehydration is a condition on its own. One of the causes of low blood pressure is dehydration. When your body is dehydrated, your body, the blood itself needs water for proper circulation. And when there is no proper circulation, when your body is dehydrated, you tend to have low blood pressure. Your blood pressure tends to drops. It drops. So it is essential you take water. So I'll be going to the prevention later. Another causes of low blood pressure, which is hypertension, is vomiting. When you're vomiting, excess vomiting, when you vomit, you tend to vomit out a lot. The water you take in, the food you've eaten, you tend to vomit it out. Then your blood pressure tends to drop. You tend to have low blood pressure. So vomiting is one of the so if your child or someone beside you is vomiting, you shouldn't just overlook and say, yeah, just take you take home remedies and you'll be fine. No, you shouldn't just overlook. When someone is vomiting 2-3 times in a day, you need to seek medical help. Another cause is bleeding. Bleeding is one of the causes of low blood pressure. Why? Because if you are bleeding, if you tend to tends to lose a lot of blood, and the blood pressure, the blood pumping around the body, circulating around the body tends to drop. So bleeding is one of the causes of low blood pressure. Another cause is fever, which we all know. Another cause is pregnancy. If you are pregnant, yes, you tend to have low pressure because there is changes in your body. Your body tends to change, and pregnancy can cause hypotension. Your body tends to change when you are pregnant. A lot of things changes in your body when you are pregnant, so your blood pressure tends to low. So it is important when you are pregnant you go for antenatal care to prevent you not knowing that your blood pressure is low. So to prevent things like shock, eclampsia, preeclampsia, and all other things, to prevent things like that, you need to what? Go for your antenatal care. You shouldn't miss one. You shouldn't miss one, so that there will be proper medical treatment, and there will be prompt an adequate diagnosis for you. So there will be quick. They'll be able to know that there's something wrong quickly, and they'll be able to attend to it quickly as well. So another causes is what is heart failure, heart disease, any heart disease, heart attack. When you have heart disease, heart attack, the heart is affected. So the heart will not be able to pump blood the way it should. So the blood pressure tends to low. Another one of the causes is severe infection. When someone is infected with a bacteria or any microorganisms, the blood pressure tends to drop. Another cause is severe allergic reaction. When you are allergic to something, a food or anything, your blood pressure tends to low because it is a condition attacking your body. Your organ or something might have been destroyed in your body, so the blood pressure tends to low. The heart may not be able to pump well because something is wrong with your body. One thing I want you to know is that once an organ is affected in your body, it tends to affect a very close organ beside it or another organ beside it. So you tend to these things, they are working together. They are working together for good. They are functioning all together. There is a connection, be it little, between organs in the body. So once one organ is being affected, others may be affected as well. So once you have allergic reaction, your blood pressure tends to low. Another cause is lack of nutrients in the body. When you don't have enough nutrients, that's why we always cry out, adequate diet, adequate diet. So it has become point to some people that they feel like adequate diet, we hear it every day. It is not necessary. It is necessary. You take your adequate diet. Make sure that all these classes of food, you have a little portion, the right portion amount of these classes of food to make sure that your food is balanced. Another cause of hypertension is that when you're on medication, there are some medications like antidepressants, when you take some drugs like anti-cancerous drugs, when you take drugs like diuretics drugs, yes, they tend to make your blood pressure drops. So I'll be talking about the signs and symptoms quickly. One of it is dizziness. You feel dizzy, you feel very light. You feel dizzy, you feel very light. If you're feeling this, once I mention everything, if you fall under this category, you're always feeling this one or that, please see your health practitioner or your doctor. So if you feel your dizziness or you feel light, you need to see your doctor, and it is always occurring time to time, frequently. You need to see your doctor. If you faint or you are feeling like you want to faint, you need to see your doctor. If you are feeling nauseous, that is you're feeling like you want to vomit all the time, you need to see your doctor. If you're feeling thirsty all the time, you feel thirsty too much, you always feel like you want to drink water all the time, you need to see your doctor. If you have a shallow breathing or you have a very rapid breathing, your breathing is not regular, just the way it should, you need to see your doctor. If you have lack of concentration, you just lack concentration, your mind is not at rest, your body is not at rest, everything is just looking somehow, you're confused, you need to see your doctor. So if you have blood vision, blood vision is one of the symptoms of hypertension. So now we're talking about prevention. As we always say, prevention is better than cure. So this is the main thing I needed to listen to carefully. One of the ways in which you can prevent hypertension is drink more water. Drink more water. We keep saying this every day, and I will keep saying it every day, that water is essential. I will not stop talking about it because water helps. It's very essential. It helps a lot. It helps the heart to work well. It helps the body to flow well. So drink more water and take less alcohol. take less alcohol, because if alcohol is help, it will only leads to dehydration. If you take alcohol, even if you take it moderately, it will dehydrate your body. I don't know. For those that take alcohol, you can testify this to what I'm saying. Your body feels dehydrated when you take alcohol. So you take more water and you take less alcohol. That's one of the prevention. Another prevention is that you eat adequate diet, especially diet with iron, zinc, and folate. It will help boost your body. It will help boost your blood, rather. It will help boost your blood. So, and once your blood is being boosted, there will be normal flow of blood, and there won't be low blood pressure. So another ways in which you can prevent this high blood pressure is you use more salt. Yes. So it's using less salt is one of the prevention of hypertension. So for hypertension to be reduced in your body, you need to reduce your salt. But for hypotension, for you to prevent hypotension, you can take more salt. That is for those that have been diagnosed with this condition, hypotension. If you have been diagnosed with hypotension, okay, you went to the hospital and you have been told that you have hypotension, then you can take more salt. So it will not, don't say I've said that, because one of the ways in which you can prevent hypotension is to take salt. Now every day you want to be taking salt. You don't even know your blood pressure, you want to be taking salt. No, that's not what it meant. What I am trying to say here is that if you are diagnosed with this hypotension, you can take more of salt. Yes, while you go on to check yourself. So regular medical checkup is also one of the ways you can prevent this condition, because when it is what you check, you can know. If you did not check it, you won't be able to know what your state of health is. You won't be able to know if your blood pressure is low or if it is high. So regular medical checkup is one of the ways in which you can prevent this condition. And one more thing is that you exercise yourself. Exercise also helps in breaking down of food in your body. It helps in metabolism. So exercise yourself regularly, and it helps. I hope with these few points I have been able to, you're able to pass a little message across to us. I am not saying you should go and be taking salt to prevent hypotension. If you have been diagnosed with hypotension, then you can take it. One of the ways in which you can prevent hypertension is you are avoiding excessive use of salt. Yes, it has a gram you need to take. You have to take 5 grams or less than per day. So I'm not saying you should now be taking a lot of salt now to prevent hypertension. Go and check yourself to know if you have hypertension or not before you start taking salt. Thank you.